So the other procedure that's gaining great popularity around the world is called OLIF, oblique lateral interbody fusion. And it simply is a procedure done with a very small incision, almost a band-aid, on the side of the patient, over here on the side. And we're not going through the back, we're not going into the muscles, we're not going into the spine from the side, so we're not touching the back. We're going from the side through a space in front of the abdomen, behind the spine, and we're not going through any tissue, so it's minimally invasive. This is an outpatient procedure that corrects major problems in the low back. It's very, very new. This procedure was actually invented here by myself and with the assistance of Dr. Data at the B.A.C.K Center. And we were basically creating a very, very small incision through a space where there are no tissues or organs, and there's one little spot on the spine you can go into and never go through a muscle. So it's the least invasive operation that exists in the spine that does a major correction. And it's fast, it's painless, it can be outpatient, and even our older patients can benefit from this. Stem cells from the patient is what is happening at the B.A.C.K Center in Melbourne. We take stem cells from each patient by going into their iliac crest bone with a small needle, pop it in while they're asleep. They don't feel it. Stem cells are taken out. We process it through a chemical matrix, so the live cells are then put into this machine, and in this machine we can separate the stem cells from all the other products in the blood. When we use the other products, these stem cells are the patient's stem cells, not embryonic. They go back into the patient in a small little tiny blood clot, and they grow living bone based on the patient's genetic code. So each patient makes their own individual living bone. No bone grafts, no cadaver bone, no problems from the operative site from taking bone out of the hip. Never again. Stem cells work, they're like little teenagers. When they grow up, they need to be told what to become. So these stem cells can become any tissue, a heart, a lung, a bone. BMP, bone morphogenic protein, was first placed in patients in Melbourne in experimental FDA trials over 15 years ago. This was the first place stem cells from the patient were used to grow living bone. Shouldn't get confused about stem cells. There's embryonic, which are nothing to do with this, and these are stem cells that every patient has within them. Every patient has their own stem cells, millions. Simply using your cells, turning your cells on to do the things we want them to do to heal yourself. Inflammation, cancer perhaps, spinal cord, heart, bone, but bone is for sure, the others are coming.